My name is Eric Padron, and I am at the H. Lee Moffitt Cancer Center. This presentation will focus on the treatment of higher risk MDS. So once you and your physician determine that you have higher risk MDS, what's the next step? In most cases, the next step is treatment. Higher risk MDS is an aggressive disease that requires some treatment to alter its natural history. The goals of treatment in higher risk MDS are as follows. The most important goal is to make patients live longer, making patients feel better, and preventing their disease from transforming to acute myeloid leukemia. So there are several treatment options for higher risk myelodysplastic syndrome. These options include FDA-approved medications and clinical trials. The FDA-approved medications are 5-azacitidine, or Vidaza, decitabine, or Dacogen, and lenalidomide, Revlimid. 5-azacitidine, or Vidaza, is given by shot, like an insulin shot, or by IV, usually a 30-minute infusion. The advantages of Vidaza are that it has been proven in a randomized phase 3 trial to make patients with higher risk myelodysplastic syndrome live longer. It also has about a 40% chance of improving your blood counts and therefore improving your symptoms. It's given over 7 consecutive days on a 28-day cycle. A cycle refers to a 28-day period in which you are given 7 days of medication and 21 days off. The most common side effect is constipation and injection site reactions. We usually advise patients to take a stool softener on the days that they have Vidaza scheduled, whether they have constipation or not. Injection site reactions can be prevented by applying light pressure after the injection is given. A downside to Vidaza, however, is that it takes time to work. The average number of cycles that patients require to see a response is 3. But in some cases, approximately 10 to 15% of patients, up to 6 to 9 cycles are required. Decitabine is a cousin of Vidaza in that the mechanism of action is thought to be similar. It is given as an IV over a 1-hour infusion. However, decitabine has not been proven to make patients with higher risk MDS live longer. It has been shown to have similar response rates to Vidaza, in other words, has a similar chance of improving your blood counts and therefore your symptoms. It is given over 5 days in contrast to 5-azacitidine or Vidaza, which is given over 7 days on the same 28-day cycle. The most common side effects are GI complaints, which include constipation and diarrhea, and lowering of your blood counts. Like any medication, these side effects happen in a percentage of patients, and taking decitabine or Vidaza for that matter does not guarantee that you will have any of these side effects. In terms of time to response, the same issue with decitabine is present. It takes time to work. The average number of cycles before patients see a response is also 3, and some people, as in Vidaza, do not capture a response till 6 to 9 cycles. Another drug which is FDA approved for the treatment of myelodysplastic syndromes is lenalidomide, or Revlimid. This was initially developed for lower risk disease and can improve symptoms in about 30% of cases. It's actually a pill that you take every day, and the common side effects are lowering of your blood counts, rash, and diarrhea. It takes about 2 months for patients who will have a response to gain their response, and those who have a response will sustain their response for about 1 year. An important question that my patients ask is, can MDS be cured? The answer is yes and no. A bone marrow transplant using a matched sibling or an unrelated donor represents the only chance of a long remission and possible cure. But unfortunately, many patients with MDS do not qualify for this procedure. To qualify for this procedure, a careful conversation will have to be undertaken between you, your physician, and the bone marrow transplant team. So what about clinical trials? Well, we've learned exponentially more about MDS in the last 10 years. We've learned of genetic mutations in MDS, and we've learned important information in the laboratory that has resulted in new drugs. However, clinical trials are needed so that we can move our scientific innovation from the bench to the patient. And participation in clinical trials may not only have benefit in your case, but will help others with myelodysplastic syndrome and are always encouraged.